Good day, viewers. My name is David Yella, and I'm from Health District Africana. Right now, I'm in front of the premises of Destiny Surgery, and today I'll be discussing about the chronic kidney diseases with Dr. Atiku to know the negative implications, the medical solutions, and the preventive measures we need to take out so that we can live a healthy lifestyle. But before then, I would like you to know that the statistical data released by the Nigerian Association of Nephrologists that 25 million Nigerians live with kidney failure. That is 13.9% of our current population of 182 million. And that only 160 nephrologists are present here in Nigeria, and that 18,000 patients need dialysis every year, which will cost them about 400,000 naira per month. Only 149 dialysis centers are present in Nigeria, both public and private, and only 600 dialysis machines are present in Nigeria. This report is alarming. Please stay tuned and follow me. Good day, sir.
Good day, how are you?
Fine.
Yeah.
Can we meet you?
Yes, my name is Dr. Atiku AM. I'm the medical director of Destiny Surgery, located here in Kano, precisely at Kundila Phase 2, Baba Impossible Street. Yeah.
Okay, thank you very much, sir. Sir, can you define chronic kidney disease in a layman's term?
Okay, in a layman's term is, well, let me simplify it. When you say chronic kidney disease, it's like a spectrum. It spans from a little defect in the way the kidney function to the most advanced derangement in renal function, meaning a kidney can be diseased, yet a person can go on doing his normal activities, passing urine, and that derangement in kidney disease, in kidney function can be progressive to the extent that it can reach from stage 1 to stage 5 when the kidneys completely stop working, meaning somebody will start manifesting with signs and symptoms of what we call uremia. So in a layman's language, chronic kidney disease is a condition in which the kidney is not functioning properly. But medically, usually we have some indices that we use in defining what chronic kidney disease is. Usually we use what we call the glomerular filtration rate, that is GFR. So if there is consistently the renal function, the GFR is less than 60 mils per 1.73 square meter area for over 3 months, that's when we say somebody has chronic kidney disease. Yes, in a broad simplified term, this is chronic kidney disease.
In that case, sir, what are the main causes or major causes of chronic kidney disease?
Yes, just like I've mentioned before, it's like a spectrum. Likewise, the causes are very, very many. So I don't think this time is enough for us to elaborate on all the causes, but we are going to talk on some very important causes. Number one, hypertension. Hypertension, otherwise called the silent killer. A lot of people have hypertension. They don't have any symptom. They go about doing their normal businesses. They only present when they develop what? Complication. And chronic kidney disease is a complication of hypertension. Somebody with hypertension going about his normal business may also develop stroke. So those patients that have hypertension has effect on the kidney. Gradually it will be killing the kidney. Now I'm using the layman's language, I don't want to be medical now. Okay. So it's going to, by effects of the hypertension on the kidney function will gradually go down to the extent that they may fail completely. So one important cause of chronic kidney disease is hypertension. The second important cause is diabetes. A lot of people have sugar. It can either be type 1 or type 2 diabetes. Usually type 1 diabetes are patients that present usually early from their adolescence. Type 2 usually, others we call it now maturity onset diabetes, is for patients that usually are above 40. They present and they don't present typically. So both conditions, be it type 1, type 2, in the long run, because of the effect of high blood sugar, it can have effect on the way the kidney functions. So it can also lead to chronic kidney disease. Then the other one is infection. If there is infection, otherwise called pyelonephritis of the kidney, that is not adequately treated, that can also lead to chronic kidney disease. And then again, some urological conditions. I mean conditions that block the normal passage of urine, either from a solitary kidney or from the bladder neck that is blocking both kidneys, or even both kidneys can be obstructed at the upper tract. They can, in the long run, they can also lead to chronic kidney disease. So in a nutshell, there are a lot of causes, and time won't permit us, but hypertension, diabetes, infection, and then obstructive uropathy. These are 4 main important causes of chronic kidney disease.
Okay, sir. Can you tell us what are the risk factors and complications associated with chronic kidney disease?
Well, if you say risk factors, meaning conditions that will predispose somebody to have chronic kidney disease, yes. In fact, I can say even the risk factors are some of these etiologies. So repeated infection of the kidney is a risk factor for somebody to have what? Chronic kidney disease. Untreated hypertension, even though it's a cause, it can also be a risk factor, because the way it causes is quite complex for us to explain here. And then there are also some drugs, taking drugs inappropriately, that are nephrotoxic, meaning they are toxic to the kidneys. They can also be risk factors to development of chronic kidney disease, among others. As I said, there are very, very many. I don't think the time is enough for us to go through them. Risk factors are conditions that will predispose somebody to have this condition. These part of this etiology I have explained are also risk factors for somebody to actually develop chronic kidney disease.
Sir, what are the signs and symptoms of chronic kidney disease, sir?
Well, if you say symptoms, meaning what the patient will tell you, and then signs is what you as the health professional will elicit from the patient. So symptomatically, also the symptoms are many. Some of them, if they are mild, they may not have any symptom until they have advanced disease, that is stage 4 or 5. However, a patient with chronic kidney disease may have hypertension, may have headache, may have dizziness, may have symptoms of uremia. They may be having cough. Yes. They may be having difficulty in breathing because of too much water inside their lungs. They may also be vomiting. Anything they eat, they'll vomit. And then they may also be having hiccups. All these are symptoms of uremia, that is terminal age. Some of them, if they have not reached either stage 4 or 5, they may notice that the rate at which they are passing urine has either increased or decreased. Some may be having what we call polyuria. Some may have what? Oliguria, meaning they are passing very scanty urine. And then as consequence to that, because they are not excreting the byproducts of metabolism from their body, they may start having swelling of the body. If it is extensive, we call it anasaka in the medical term. So in a nutshell, these are the symptoms and signs. Well, as per signs is when you examine the patient, well, looking at them, they may have a puffy face, they have a swollen face, they may have complete swelling of the body, they may have what we call uremic frost, that is in the late stage. They may also have hypertension, they may have arrhythmias, meaning their heart is not functioning appropriately or the way it's supposed to function. And a lot of things that one can take, because it leads to a lot of metabolic derangement. Yes.
Thank you, sir. Sir, what are the diagnostic tests one can take to easily detect this disease in its earliest stage?
Okay, well, as I said, it's a spectrum from mild to the severe. So the most important thing is, if one has any complaint regarding change in the way he passes urine, he should go and see his physician for proper checking. At first, at the early stage, one may not take it to be something serious until it has advanced. That's when one will start having symptoms of uremia, which are very serious, and many a times the only treatment option will be what? Dialysis, which is now expensive and is very difficult to maintain. So one should visit his physician at least annually for checkup. During that checkup, to uncover this condition, the physician will order for urinalysis. They will take the urine, look at normal chemicals inside. There are some things, if you find inside, one will have to further investigate the patient. And then apart from that, there are some blood investigation, for example, serum, urea, electrolyte, and creatinine. This directly is assessing the function of the kidneys. There are some chemicals in us that should be kept within certain range. So if they are out of range, I mean if they are more than what they're supposed to be, that is a telltale sign that that kidney may not be functioning well, and that kidney not functioning well maybe has a consequence of a chronic kidney disease that is unknown to the patient or the physician until after this test. Then one will also would like to order for abdominal pelvic ultrasound. Ultrasound can look at the kidney, how big they are they normally situated, are there good corticomedullary differentiation. Usually patient with chronic kidney disease at the later stage, they have what we call a shrunken small kidney that is echogenic according to the sonologist. So when one find that, one should further investigate the patient. There are other tests that are more expensive, more elaborate, but this simple test that I just explained can be enough to at least have an idea whether the kidneys are functioning or not. If they are not functioning, then one would like to also order some more elaborate tests. In some instances, to make a definitive diagnosis, one would like to take what we call renal biopsy. It is an invasive procedure whereby under ultrasound guidance a needle can be passed into the kidney in order to take a chunk of the kidney so that it can be examined histologically and find actually what is the actual cause of that chronic kidney disease. It can be hypertensive nephrosclerosis, it can be diabetic nephropathy, it can be other form of nephropathies that can lead to chronic kidney disease. So in a nutshell, in a layman's language, I think this test can be carried out by even family physician. If they see any derangement, a lot of protein in the urine, a lot of white blood cell or red blood cells, then that will further stimulate them to do more tests that will uncover actually what is wrong with that kidney.
So, what are the preventive measures one can adopt to live a healthy lifestyle so as to prevent any further attack on one's life in the future, sir?
Well, healthy lifestyle is something that should be encouraged, because now the main thing is prevention is better than cure. Because the costs of maintaining patients with chronic kidney disease is very high, even in developed countries. Talk less of our country where we have a lot of financial difficulties with families. Well, one should be visiting his physicians regularly, I mean annually, for proper medical checkup, because some of these conditions can be diagnosed early that could lead to chronic kidney disease, e.g. hypertension, diabetes. If they are diagnosed, if properly treated, I don't think that patient may ultimately or may likely progress to chronic kidney disease. As now in the habit of taking drugs that are not prescribed, or even if they are prescribed some drugs, they tend to take those drugs not appropriately. I mean, they may exceed the dose, they may take longer than necessary. One should know that any drug given is a poison. The reason why we give it, that's when it will be useful to you or not. Some of these drugs are notably nephrotoxic, meaning they are toxic to kidney. E.g. gentamicin is an injection that people are abusing nowadays. So if one is taking gentamicin, one can completely knock off his kidney and come down with what? Chronic kidney disease in the long run. And then eating healthy. You know, now we are trying to westernize ourselves. We are adapting their lifestyle. Some people are smoking, some are abusing alcohol and the rest. And then these illicit drugs, they all can lead to derangement in renal function and ultimately to chronic kidney disease. So a healthy lifestyle, not taking drugs that are not prescribed, eating healthy diet, exercising regularly, taking good clean water, I think they will all go a long way in improving somebody's life and also reduce the chance of coming down with this chronic kidney disease.
So, do you have any word of advice for our viewers?
Well, word of advice is that this health, if you are healthy, please try to maintain it by living a healthy lifestyle. Try to be visiting your physician regularly. Try to be encouraging others to live a healthy lifestyle. Because once you come down with chronic kidney disease, especially advanced stage 4-5, it's really difficult even if you are financially capable. Because the ultimate treatment is renal transplant, which is very expensive. Not even expensive. After the renal transplant, one will have to be on drugs, immunosuppressant, that will allow that kidney to survive. in one's body. Even as at that, one is really restricted in his lifestyle. You can't do a lot of things that a healthy person can do. So my word of advice is for people to really look after their health. If one is hypertensive, should go and be seeing his doctors regularly, taking his drugs regularly, and doing follow-up regularly. Likewise, those that are diabetic should also take their condition very seriously, taking their drugs regularly, visiting their physicians regularly, and also exercising regularly. Well, exercise is very important, not just to chronic kidney disease, hypertension, or diabetes, and other health. It has been found that people that exercise regularly are found to be more healthier than those that lead sedentary lifestyle. Most of the diseases you find in sedentary lifestyle can be eliminated or reduced to the barest minimum if one actually exercise regularly. Yes.
Thank you very much, sir. It's a nice time having you around, sir. It's our pleasure, sir.
You're welcome.
Thank you very much, sir.
Yes, sir. See you some other time.